Easily find, book, and manage your travel nursing assignments with the AMN Passport app. Download today.
Back to charting, it's huge, huge, huge. It is absolutely the care plan. I have seen charting, like you said, to nasal cannula, like they've been off for like a week.
Yeah.
And I'm like, stop it. But it is the standard we're held to. It is, we create nursing diagnoses that go along, the medical diagnoses. And when it's up on the big screen, you know what that expert, that wolf nurse is going to be opining about?
Yeah.
What's in our lane?
Or even like, in the care plan, a lot of times it's, the care plan is whatever just automatically comes up from the EMR. Like, if you chart on a Braden scale or something that they're at risk for skin integrity, then like that's the only thing that pulls through in the care plan. And so in your care plan, the only thing that you're looking at is skin integrity. Like you have to go through, be like, oh, they're here for pneumonia, they're intubated, like they have a respiratory issue. You have to chart on that. They're mechanically ventilated. That's also part of the care plan. Like you have to individualize it. It's not just skin. Like, it's just.
And part of this is that there should be like an admission nurse for that very reason. Because again, sometimes you're so caught up that you're just like, the smoking cessation, a lot of people don't realize that's tied to a core measure. And so, the hospital's not going to get paid. If they ding on this, right, vaccine, smoking cessation, these are all things that will get that as a core measure. And so if you don't meet that, then... But I tell nurses, this is what you're held to. That will be up on the big screen. And the other thing that I'm big on is stop documenting noncompliance. Don't even get out of the habit of using that word, because now it's on the big screen. And now I just brought up your nursing care plan. So you said they are noncompliant with their CPAP. So you talked to RT, right? So show me a note where you talked to RT. You called respiratory therapy down. What resources did you give them about masks, about, did you talk about nasal prongs? Because we did a simple Google search in here. Did you talk to them about anything? You just called them non-compliant nurse? Don't do that. So I document all that stuff, and then you document, or I tell the nurses to document that patient made a personal choice. You see how that sounds less offensive, and people are allowed to make their own choices. And then all the education that you did is there, and then you write that the patient made a personal choice, not their way, their CPAP, reinforced education.
Yeah.
Like, you label them as non-compliant. They have a personal choice. So please stop documenting that.
I feel like that in itself is such an issue, that we forget that people have their own ability to make bad choices. That's just people, if they don't want to wear, if they're a COPD or in the ICU and their CO2 is 90 and they don't want to wear the CPAP, that is their choice, like that. It's just like, you can't, restrain somebody. I mean, you also can't wear BiPAP if, anybody's restrained, but you can't force somebody to, do something that is just, if they don't want to do it. I mean, people have the choice to be.
But we're obligated, because we do have a duty, and that is a loaded word, to educate you, to give you some options.
Absolutely.
But after that, you are allowed. You talk to your doctor, and that's not on me. I educated you. I did my, you know what the possible outcomes in. I let your doctor know, hey, dude, he's not wearing a CPAP. Like I'm letting the doc know, because if I'm documenting that, I'm letting the physician know, and that's on him. And maybe it's not like I'm giving him a call, right? I mean, in rounds, I'm just saying as well, hey, he's not wearing a CPAP. We've educated him stuff. I just want you to know that. You know what I mean? And then in my note, I'm documenting that I let Dr. Smith know, not in an ugly manner. It doesn't have to look ugly, right? It doesn't have to be offensive. It is your duty to let the doctor know you're not managing that patient's care. You're part of the team, but the doctor is managing this patient's care, and you have a duty to let the doctor know that the patient is choosing not to wear their CPAP after you've done all your education.